It is my greatest pleasure and honour to send this message to all my fellow nurses on International Nurses Day. It is traditionally a day to celebrate all that nurses contribute to the world, and over the last year, the work that you do could not have been more important or more valued. For this reason, it is not only a time to celebrate, but it is a time to say thank you. Thank you to every one of you who has worked during the pandemic to provide nursing care to patients during the darkest of times. It has been a year like no other when our profession has united in its response to COVID-19, and it has shown the world that against all odds, we will always be there to care for our communities when they need us most. I know that this has come at a high price. The pandemic identified the heavy burden that nurses have carried, and in many countries, the crisis was worsened by historic underinvestment in nursing education, recruitment, retention, and leadership. This was articulated in the State of the World's Nursing Report published last year. But now, as we reflect on the impact of the pandemic on our profession, it is clear that we must act, and we must act now. The task to build the global nursing profession to be a stronger, resilient, highly trained and credible profession is immense. We know that nurses are struggling with mental health issues, burnout, and many are looking to leave the profession altogether. We must look after the nurses that we have, as well as focus on recruitment to the profession. To do this, strong leaders are required at every level, and we must invest in nurse leadership that not only creates leadership opportunities for young nurses, but supports and develops those already in practice. It is crucial to have high-level leadership in place for the nursing professions to ensure that working conditions, recruitment and retention strategies are prioritised. Establishing nursing leadership at national level is key to ensure a strong and sustainable nursing workforce now and in the future. From the State of the World's Nursing Report, we know that the presence of Government Chief Nursing Officer and National Nursing Leadership programs are associated with a stronger regulatory environment. Looking ahead, whether you represent associations, government bodies or academia, or are a nurse working in our hospitals and in our communities, we all have a role to play to inform directly or indirectly Ministers of Health and Social Care to support national policy dialogues around investment in nursing and midwifery workforce in order to achieve the triple dividend for health, economic growth and gender equity. Continue to provide the highest quality care that you can in all that you do. It is through the delivery of high quality care every day that we can demonstrate the difference that nurses make to health at every level. Your work over the last year has been extraordinary, and I thank every one of you for your contribution and for your compassion. We will get through this crisis, of that I am sure, but we will only succeed if we work together. We must share our ideas, we must learn from each other, and we must support our colleagues both nearby and across the world. Nursing is a family, and families thrive when they are united. On this very special day, I would like to remind our large nursing family, over 27 million of us in total, that we are stronger together. We have more in common than divides us, and together we will emerge from this crisis and rebuild our world for a healthier future. Have a wonderful International Nurses Day in this, the International Year of Health and Care Workers. Focus on the good things that you have achieved and look after yourselves and each other. Thank you for everything you do.